CMH has had at its core a focus and a culture of excellence in everything we do, and I think that really starts with our mission, vision, and values. And CMH has always been a value-based organization, and at the heart of our mission, vision, values is the patient. As we go into our new facility and as we look at the future at CMH, I think the new facilities that we have, they better reflect outwardly to the public what we already do as an institution inside. Over the last several years, we've really been focused on a culture of high reliability and ensuring that patients get that high level of quality every time, no matter where they go. At the forefront of what we do is high quality, safety, zero harm, making sure that we go through all the appropriate steps to make sure you get excellent care every single time. Recently, we hired a new chief medical officer, and we're changing the dynamics of that role with a vision to ensure that we're leading with more of the physician voice involved in the way that we provide care across the system, allowing physicians to have more time dedicated to helping lead the organization, whether it's at the CMO level or the department level. I want to see physicians more actively involved in planning for the way that we provide care in the future. In the emergency department, we do have a new leader in that department as well, Dr. Smith, who's doing a fantastic job. We have in the ER employed physicians, meaning they're all fully dedicated to CMH. Dr. Smith is very aligned with that vision to ensure that in the emergency department that we have best-in-class care there. And I think the ER group is very good about making sure that we're very attentive to the needs of the patient and get them in the right place for the right care at the right time. And I think the new facility is going to allow them to continue to elevate that. One of the things that was really key is developing a nephrology service line and developing a dialysis center to meet the needs of the patients. The first step of that with the creation of the dialysis center took place when we opened the new center in December. And then you're going to see as that center grows, we're going to be able to take care of inpatients in a better way, patients that are in our long-term care facilities, patients that want to stay home and get home dialysis. All those things are going to be available. And that's an example of what we mean when we say that we're highly reliable, excellent care, continuing to offer more things to our patients close to their home in a way they can get access to them so that they get good outcomes. A lot of that's our motivation with the partnership with the Central Care Cancer Center. As we look at a very difficult healthcare environment, the best way that we can ensure that we have these oncology services in our community is to partner with them, to leverage access to the hospital, to ensure that we integrate that into our system so that we can share information more readily. You're going to notice that you still have the same physicians, you still see the same staff taking care of you, the same quality of care, but then with the support of the hospital, just to continue to elevate that care and ensure that we have that 5, 10, 15, 20 years down the road, that we're able to continue to grow that. Another area that we're really focused in on is making sure that we have access for behavioral care. As much as we've expanded those service offerings, we just realized that we need a partnership to be able to bring more services to the Bolivar and surrounding communities. And Burrell is one of the known and trusted partners in our region for providing behavioral services, and so we've sat down with them. We've worked on a strategic plan for how that we can work together to get more resources here in Bolivar. And they're very engaged with that. They're very excited to work with us in that endeavor. The exciting thing about being a part of CMH is we have so much community support, and the community support is vital to what we do, because if patients are using us, if they're trusting us with the care that we provide to them, then we can grow that and bring more care opportunities here. And we have seen that just continue to increase over the last several years, and it's allowed us to have a growth vision. Instead of drawing back, we've been looking at how do we expand services in the Bolivar and surrounding areas. What we have coming up this year and what we have coming up in the years ahead, it's a very exciting time to be a part of CMH, and it's an exciting time to be a part of the Bolivar community, because we're growing to meet the needs of the community. That's going to allow other aspects of the community to grow, and it's just a great place to be in Bolivar, and the things that we have going on are very exciting. I'm very optimistic about our future.